So this session, is being recorded and will be available at the link, as you see on the screen here. And we have today our presenters with us, Annette Graham, the Executive Director, Central Plains Area Agency on Aging. We have Kaylee Hervey, she's our Epidemiology Program Manager here at Sedgwick County Health Department, and we also have Cody Charvette, the Operations Officer for Sedgwick County Emergency Management. And again, I'd like to welcome everybody who has joined us for this afternoon session. Thank you very much for your time and participating with us. My name is Susan Lee, and I am in Sedgwick County Health Department as the Information and Guidance Coordinator for COVID-19. Today, we have our agenda, which we will talk about our COVID updates, the Sedgwick County NP and saliva testing, and the antigen test kit. A subsequent email was sent out earlier about that. And then we'll have some information on CMS and KDADS testing and reporting requirements, vaccine updates, update on the stopgap program and N95 decontamination, or the respirator program now, and Sedgwick County Phase 2 metrics, update on visitation, and then wrapping up with Q&A from our presenters with some resources. And during this session, you can enter your questions in the chat box, and we'll answer them as we go along. Thank you. Our next meeting is scheduled already for May 28th, and the same time. I'm letting somebody into the room, so we will be glad to hear any topics or suggestions for presentation during the meeting. If you have any, please email your comments and suggestions to me, for this is an area where we can maintain our ongoing contact, provide updates, and listen to your suggestions and ideas as we go along. And I would like to turn the meeting over to Kaylee Hervey. She's our Program Epidemiology Manager, and she will present the updates and testing information. Kaylee, thank you.
Good afternoon, everyone. As of the 4:30, in the United States, we've got 32,290,175 cases in the United States. 309,130 cases in Kansas, 47,173 cases in Sedgwick County. We do have now 611 deaths in Sedgwick County. And when we look specifically at adult care homes, we've had 88 total adult care home clusters, and we currently only have about 8 active cases in those clusters. So they're fairly low right now, which is really good news. When we're looking some information about nasopharyngeal or saliva testing for adult care homes staff can still receive no-cost walk-in testing at the health department. We're currently still at Sedgwick County Park in the Sunflower Shelter, and the best way to get there is through the entrance off of 13th Street, and then just kind of follow the signs to that shelter. We're doing testing right now, still Monday to Friday, 8:30 a.m. to noon. And there is no appointment needed. It's first come, first serve. Test results are really generally available within 12 to 24 hours right now. And if a staff or a resident in your facility does test positive, then other staff and residents in that facility should be tested for Sedgwick County and KDHE recommendations. So that same thing is available for Sedgwick County residents. So with or without symptoms, they can also receive that same no-cost walk-in testing. And they will go to that same location. Again, no appointment is needed. They can be tested once, with or without symptoms, and then results are the same, generally available within 12 to 24 hours. So So there is a procedure available for COVID-19 testing of long-term care facility employees from Sedgwick County, and you can access it at the link provided in the slide. So we also want to let everyone know that the health department currently has a large supply of antigen test kits. So those are the rapid kits that you can do to get faster results, available upon request right now. So if you are interested and would like to use those kits, you can email Susan Lee, and she's provided her email address for that. Right now, you would need to email her the quantity requested, and you would have to order them in quantities of 20. And so you'll get 20 tests per kit requested. We'll also need to know who is going to be picking them up, and then what date and time you would like to do that pickup.
One thing I forgot to add on the slide is the pickup times would be between 8 a.m. and noon, and then an hour break for lunch for the folks here at the desk, front desk, and then resuming from 1 o'clock to 4 o'clock. So if you could arrange your times according to that, that'd be great. Thank you.
And then we have also provided some guidance about those test kits. So if you are going to use those, or if in general you're using antigen testing kits, KDHE does have some guidance on kind of how to interpret those and how to use those results, you know, whether they're positive or negative. It kind of depends on the situation as to how you proceed. Although for most long-term care testing, you should, if you have a positive, then confirm it with a PCR test within 48 hours. And then they also have information to KDHE's online reporting portal for that user guide. So when we look at CMS and KDADS COVID-19 testing requirements, again, nursing facilities or adult care homes should presently do routine testing intervals and continue those for staff who have received COVID-19 vaccine according to the CMS and KDADS guidance. This is testing of staff and residents with COVID-19 symptoms or signs, testing of staff and residents in response to an outbreak, and then routine testing of staff based on the county positivity rate. And then the CMS final rule on nursing facility testing, we do have that interim final rule was established as an additional policy and regulatory revisions in response to the COVID-19 public health emergency. And that does have information about long-term care facility testing requirements, and then a revised COVID-19 focused survey tool. And then also there is some information available from CDC on their guidance for SARS-CoV-2 point of care testing and rapid testing, and they did update that in March. And so this is regulatory requirements for point of care testing and who can do point of care testing, because sites that are doing the point of care testing are required to have a clinical laboratory improvement amendment or CLIA certificate. So KDADS nursing facilities, their guidance issued on October 27th of 2020 does require nursing facilities to use the 2-week county positivity rate published by KDHE, and the link for that location is provided. They have updated their website slightly, and so it used to be when you went to their website, nursing home metrics was directly available. Now when you go to the website, you will click on the box labeled COVID-19 metrics, and then that will take you to a page that does have nursing home metrics as an option there, along with reopening metrics and the school metrics. So it's still there, you just have to click an extra time to get there. And so right now, KDHE has Sedgwick County sitting at 4.2%. So that does put us in the green area, although we are going up a little bit in our percent. If I remember correctly, last month we were at 3.5-ish, so we have gone up a little bit. And that is based on our current rolling 14-day period. So KDHE looks at the past 14 days, and that's how they calculate that metric. And again, we provided the link to where that's available and how to get there under the COVID-19 metrics. When we look at testing and reporting for CMS-funded facilities, KDHE does have a reporting portal for mandated facilities via the BINEX rapid test or any other point-of-care testing. You can go to that website, and that's where you can do your uploads. If the facility is CMS-funded, and if the test is positive, then the individual must be tested via a nasopharyngeal or other PCR test within 48 hours. And so that, whether you're testing them with a rapid antigen and they test positive, they have to be tested to be confirmed within that 48-hour period. When we look at CMS reporting requirements for nursing homes, again, all COVID-19 testing results are required to be reported. This is both positive and negative tests, and that is both point of care or send out specimens need to be reported. If you're doing point of care testing, again, you can use that KDHE reporting portal to provide your results, and those do need to be in there within 24 hours of testing. KDHE will then report to CMS on your behalf after you report into that reporting portal, and they will also make sure that those results do come to the local health department. If you're sending out your specimen to a lab, then that lab typically is doing the reporting for you, but if you're doing point of care, then you need to be using this portal. And if you have any questions on how to report or that reporting process, you can email KDHE at their EPI hotline email. So moving into the COVID-19 vaccine, if you need vaccine assistance, you may, and that includes administration of vaccine for new residents or any other assistance you may need, you can contact your initial CVS or Walgreens that held the clinic at your location, or other locally enrolled approved pharmacy partners for vaccination clinics at your site. If you have already done that and you're not having any luck or you need additional assistance, then you can email the health department. And so that email is on the slides, but it's going to be meddistribution@sedgwick.gov. And we will reach out to you and coordinate either partnering you with a pharmacy or helping you to transfer vaccines or whatever best suits the needs of your facility to make sure that your residents are vaccinated. Your staff can schedule their vaccine appointment online at the sedgwickcounty.org on our vaccination scheduling portal. Right now, you can also, we've changed it to be walk-in. So we are no longer doing the appointment required. The staff can just walk in now at our location at 223 South Main. If they do want the J&J vaccine, that Johnson & Johnson, then we are still requiring appointments for that. And we are currently doing that next week on Tuesdays and Thursdays are the only ones set for that J&J, and it may be extended further depending on vaccine supply. If you're wanting to serve as a vaccine provider, so you want to be able to give your own vaccinations, you can still sign up at through KDHE, and you would have to review the KDHE CDC COVID-19 vaccination program provider agreement. And if you do have questions, you can reach out to KDHE directly at either the phone number or the email provided. And so now I'm going to turn it over to Cody for information about requesting and ordering PPE and N95 respirators.
All right, thank you, Kaylee. Good afternoon, everyone. The process for ordering for KDADS licensed facilities, as we see on the next page, all those that are eligible under that, you should know if you're a KDADS facility by now or not. What we're doing for them is ordering the PPE supplies through the stopgap program. And of course, the qualifier hasn't changed. You first must try to get the PPE supplies yourself, whether it's through vendors or through the South Central Regional Healthcare Coalition. I know Deanne has a lot of supplies that she has gotten through the state program that runs the healthcare coalitions. So if you haven't become a member of that already, that's a good reason to. It's free to join. Get a hold of Deanne, and she can hook you up with PPE as well. If you're unable to get it through your providers, through the Regional Healthcare Coalition, or through your normal channels, then you can go to KDEM's Business PPE Stopgap page, and you see the link that will come out on the slides. They will require a proof of denial, if you will. They will ask you to show them that you tried to order this PPE, you tried to get through other measures, but you were unable to do that. The documentation that they're looking for, you see that at the bottom there, something that indicates it's back order, something that indicates they can't supply it for you. But of course, supplies are getting built back up. The things that are supported through the stopgap program are on the next slide: the mask and face shields, the gowns and coveralls, and gloves, as well as some other PPE items that are on there. Now, there is still an exception to this. If you have an immediate urgent need, perhaps you've had an outbreak at your facility and you were short supplied to deal with it, now that you've got somebody and the whole staff or the whole facility may be at risk at this point, then you can get those immediate needs filled through us in emergency management, through our logistics team. We did, a couple months ago, change the process for that, so you will order through a shopping cart type of system, and you have to have a login account to do that. So the first step now would be to contact logistics@sedgwick.gov and let them know that you need to get an account in order to make an emergency need. You won't be able to, you won't be required, rather, I should say, to supply the proof of denial, but we will need you to include an explanation of what makes this an urgent circumstances. We'll also need your contact information so we can follow up with any questions that we might have. Now, if you're a first responder or other government agency, nothing has changed there. You still will order through us in Sedgwick County EOC. You'll still use that shopping cart. You should already have your login information, but again, if not, get a hold of us at logistics@sedgwick.gov for any questions about ordering locally. Any questions about ordering through KDM, there is an email address that they provide at the end of the stopgap application, and you can direct your questions to them. Speaking of N95 respirators, of course, originally, when the pandemic struck early on anyway, N95s were very scarce, and so we started to take drastic steps to conserve them. We were decontaminating them through the Battelle system or however your facility was doing that. And so now that we have started to see vendors get them back in the warehouses and they're back on the shelves, the FDA has come out and said, let's move away from those crisis conservation tactics and let's just start using new masks every time we need them rather than reusing old ones. So that's the plan for now. If you can, you need to get your staff the new N95 mask. If your vendor supply hasn't quite caught up yet, you can still get the N95s either through the Healthcare Coalition, through the Stopgap program, or if you meet the criteria through us in the EOC. And when these slides come out, you probably have already seen the letter from the FDA, but there is a link to that letter down there at the bottom of that particular slide. So that's all we have for the PPE side of it, and I'll stick around in case there are questions later. Thank you.
Thank you, Cody. So looking at now kind of our metrics for when we're looking at our case levels, we are still in phase 2. When we're looking at vaccination, we are vaccinating basically anyone 16 and older, so in phases 1 through 5. Right now, because we do have the Pfizer vaccine, and that is authorized for 16 and older. Moderna and the Johnson & Johnson are both authorized for 18 and older. So looking specifically at our metrics, we are sitting at about 4.1% right now for our percent positive. And you can see our testing level has gone down a little bit in the past 2 weeks, but we're sitting at around 7,000-ish tests per week for that. So the metrics are updated weekly on our website. And then you also, just some general notes, the KDHE metrics that they use we put them in blue. And then we also are having numbers reported up to by test days. So we do get numbers at different days, so things can change from report to report. Most of those changes do occur in the most recent weeks. And then when we report deaths, we do report those by the date the patient died. And now I'm going to turn it over to Annette Graham for updates on visitation.
Hey, good afternoon. There's really not much new on the visitation guidance at this point, but we'll go over kind of where we're at. And of course, the visitation guidance does incorporate a very person-centered approach and continues to adhere to the core principles of the COVID-19 infection prevention. Next slide. So in keeping with the guidance, again, that person-centered approach, KDADS does provide a template for that and recommends that facilities follow through with their guidance and for a person-centered approach, really need to assess the residents' visitation preferences. So really looking at that individual and how they prefer to have that visitation and things of that nature. So you're to document responses on a resident visitation preference questionnaire for each residence, and that template is at this listed website for facilities to assist them in collecting this information. slide. So when you look at the visitation guidance, you need to follow CMS for nursing facilities and KDADS guidance for adult care homes, anybody licensed by the state. So the visitation guidance was revised on March 10th of 2021. And here are some links for you to go find that. If you have not reviewed that lately, it would be good to make sure you're up to date on that. The KDADS visitation guidance, which mirrors but really expands upon that guidance for the adult care homes, was issued on March 15th, 2021, and there is a link for that. Per KDADS guidance, facilities need to consult with state local health departments when an outbreak is identified and to continue to ensure adherence to the infection control precautions, which are recommended to reduce any risk of COVID-19 transmission. Right. So it's important to remember that the guidance applies even if all staff and residents are fully vaccinated. As we all know, vaccines are not 100% effective. CMS and KDADS, when they talk about fully vaccinated, is that refers to a person is over 2 weeks, at least 2 weeks following receipt of the second dose in a 2-dose series, or for individual receiving a single dose that they're 2 weeks or more past that the 1 dose. And that is per CDC's public health recommendations for vaccinated persons. So the definition's there. Next slide. So again, just to reiterate that facilities are required to use the KDHE 2-week county positivity rate and use that for the level of indoor visitation. And at this point in time, I'm sure that all of the facilities have made their reopening and visitation plans. But if you need to make any changes, then this is that you can continue to do that. So again, just reposting where you can find that site for the COVID-19 metrics, because those are updated on a regular basis, as Kaylee pointed out. Sedgwick County Health Department Epidemiology will review a facility's new or revised reopening visitation plan with a 5-day review period if the facility is wanting that. If you want that, please reach out and email that plan to Susan Lee at the email site listed here. Right. So for the KDADS visitation guidance for long-term care settings, guidelines apply to all long-term care settings, including nursing facilities, assisted living, adult board and care homes, homes plus residential healthcare facilities. So the types of visitations include indoor, and those would be during low and medium positivity rates and are in accordance with the facility's environment and the residents' needs and that person-centered plan. So during low, medium, and high positivity rates, ones that are allowed always are compassionate care, outdoor, and window visitation. So there's a multitude of ways that visitation can be conducted, and that would be based on a facility's structure and residents' need. And these include, for indoor, could include in the residence room, in visitation space, and of course, outdoors. So CMS continues to recommend that facilities and residents and families, again, adhere to the core principles of COVID-19 infection control, including maintaining physical distancing, conducting visits outdoors when possible and when appropriate. Next slide. So again, we just kind of wanted to reiterate the visitation guidance for long-term. If it's 5% or less, then it's in green. And if it's medium, 5 to 10% would be yellow. So the visitation should occur according to the core principles of that COVID control and infection control. If our positivity reached above 10% or above 10%, then visitation, again, would only occur for compassionate care situations according to the COVID-19 infection prevention and facility policies. And there is a link for, again, we're going to keep showing that to you. There's a link for the positivity rates. Next slide. So here's some links, some helpful links for you. for CDC guidance on reducing risk and preventing spread of COVID-19. So I've got the CDC guidance for nursing homes and long-term care facilities, the CDC interim infection prevention and control recommendations for nursing homes and long-term care facilities, and then some for recommendations from CDC for the healthcare personnel during coronavirus 2019, and then some updated healthcare infection prevention control recommendations in response to COVID-19 vaccination. So just some helpful links for your information there. Next. So when we go back and look at visitation, we know that during the time of COVID and the pandemic, it has had a detrimental effect on individuals residing in nursing facilities and in adult care homes. So the visitation is really important in how that is approached. So it should be conducted in a manner to, of course, continue to increase prevention measures and reduce any potential spread. So you need to be sure that you continue to screen all visitors for symptoms of COVID-19, which includes temperature checks. Residents and visitors are still required to wear a cloth face covering or face mask for the duration of their visit, even if they have been vaccinated. Continue to perform that hand hygiene using alcohol-based hand rub or washing hands upon entry. Need to be sure to ensure provides sufficient space for the visitation, and then practice social distancing. Now, a caveat here is fully vaccinated residents may choose to have social contact. The resident and visitor, however, are required to continue to wear a mask and perform the hand hygiene before and after the visit. So there is that little caveat around the social distancing. Next slide. So again, when the county positivity rate exceeds 10%, indoor visitations are not allowed except for compassionate care visits. For CMS, guidance, no new nursing home, if there's no new nursing home onset of COVID-19 cases in the nursing home for 28 days, and for KDADS, no new onset of COVID-19 cases in the last 14 days, and the facility is not currently conducting outbreak testing. So those are, again, some criteria and some exceptions for the visitation. So if a facility is having a new onset or is having an outbreak, then again, you would go to no indoor visitation. Next slide. So limit indoor visitation, COVID for unvaccinated residents when the county positivity rate is above 10% and fewer than 70% of residents in the facility are fully vaccinated. So kind of some key components to look at if there is an outbreak. For vaccinated or unvaccinated residents, when a confirmed COVID-19 infection occurs, until they meet the criteria to discuss, so you would limit that indoor visitation if there's a confirmed COVID-19 infection until they meet the criteria to discontinue transmission-based precautions. And when in quarantine, when the individual is in quarantine for exposure to a suspected or confirmed COVID-19 case, until that person meets the criteria for release from quarantine, that's when you would limit the indoor visitation. Okay, next slide. So during an outbreak testing, when should indoor visitation be suspended? Visitation can resume for residents in areas or units with no COVID-19 cases. So if in the first round of outbreak testing, it reveals that there's no additional COVID-19 cases in other areas, that would be the key thing to remember there. Visitation should be suspended in the affected unit until meeting criteria to discontinue outbreak testing. So for an example, if the first round of outbreak testing reveals 2 more COVID-19 cases in the same unit as the original case, but not in other units, then visitation can resume for residents in the areas with no COVID cases. Visitation should be suspended for all residents, vaccinated and unvaccinated, until the facility meets the criteria to discontinue outbreak testing. For example, if during the first round of outbreak testing, it reveals one or more additional COVID-19 cases in other areas or units of the facility, example, 2 new cases in 2 or more units, then the facility should suspend visitation for all residents, vaccinated and unvaccinated, until the facility meets the criteria to discontinue the outbreak testing. So that's just some important things to look at if there is an outbreak or a positive case, and how to proceed with the visitation and the quarantine activities. CMS and KDADS guidance does discuss outdoor visitation and recognizes that it may be limited by weather, the resident's health status, or the facility's outbreak status. That when providing for outdoor visitation, you need to ensure it's adequate staffing and infection control to maintain observation with a degree of privacy. Now that would be when there's, so that's a little bit, if you're in a facility that doesn't have any outbreaks, then you really don't have to maintain oversight for that. You need to make sure that people know that there's a requirement for social distancing. And if you have visitors or residents that are not able to follow those regulations, then that would impact that visitation. But you don't have to provide oversight for those outdoor visitations. Just have to make sure you have your policies and that visitors know what the requirements are for social distancing and masking. KDADS does allow for children's or pets to be in control of the adult who brings them. So you can bring, so they can be children's or pets that come for the visit, but the adult has to make sure that they're ensuring that they have control over that. Okay, next. So just kind of reiterating about the window visitation, that it is allowed in different situations regarding the county positivity rate, the vaccination status. And as always, kind of that person-centered approach, you need to really decide whether a visit is right and fit for the individual. And here's some safety measures to keep in mind. About the 3 feet of space, and the vaccinated resident can choose to have close contact. Again, a reminder that a vaccinated resident can choose to have close contact with and touch the visitor with those masking requirements and hand hygiene in place. Next. So for compassionate care visits, again, at any time, so even if the positivity rate exceeded 10%, compassionate care visits are always allowed during any phase, during any positivity rate. Facilities will determine when those compassionate care visits are appropriate, but it is up to the facility, but to look at more than just if that individual is in hospice care or if the resident is in an active phase of dying. So really looking at the resident's illness, disease, if it's worsening or life-threatening, if the resident themselves is showing signs of decline physically or mentally or socially, if the behavior is changing, the resident is withdrawing, not eating, showing signs of significant depression, or just a change in behavior that would reflect the need for that visit. Next slide, thank you. Here's just some information that KDADS put out, nursing facility visitation guidance. So really this is for visitors. You can go to the website and find that. It really helps for visitors to help them understand kind of what to expect during a visitation. So it's some good information that you could make available to family members and others that would be visiting. Okay, next. And finally, it's important to remember that when visitors are coming in, that they need to be informed that they need to report any subsequent illness within 7 days of the visit. They need to report their illness to the nursing facility and or the adult care home and to Sedgwick County Health Department just to monitor any potential exposure.
Okay. Thank you, Annette. So when we look at the COVID-19 quarantine guidance, neither CMS nor KDADS requires residents to quarantine upon returning if they leave the facility for an appointment or an outing. KDHE isolation and quarantine, their frequently asked questions document, does specify an exception to quarantine for vaccinated inpatients and residents in healthcare settings following exposure. Basically, if they are vaccinated or not, basically any residents in healthcare settings, which includes long-term care facilities, should continue to quarantine following exposure to someone with suspected or confirmed COVID-19. If that exposed person becomes symptomatic, then they should be tested via PCR or an antigen test. And then that guidance is available at the link below. So we do have some additional resources for you. There's information here from CDC, CMS, KDHE, Department of Emergency Management, Department of Aging and Disability Services, the Health Department, Central Area Agency on Aging. There's some references specific to COVID-19 testing and reporting that you can find from CMS and also the KDADS and executive order. So those links are provided as well. Some additional information from KDADS for those, the testing strategy and the testing status report. And then for vaccination, we also have information if you're wanting to become a provider through KDHE to provide vaccines. We have that link for the COVID-19 vaccination plan and also the enrollment FAQs. And then information about the federal retail pharmacy program for COVID-19 vaccination and CDC's guidance for that. And then just some additional vaccine references from the CDC specific for long-term care facilities or healthcare personnel. And then also, as Susan had mentioned earlier in the webinar, you can view any past webinars on the Sedgwick County webpage, and that webpage is provided, and this one will also be posted there. And if you have any follow-up questions or comments, you can email Susan, and her email is provided. And then that concludes our presentation. So at this time, if you do have any questions, feel free to start putting them in the chat. And our next webinar will be, again, May 28th at 2 p.m.
Thank you, everyone, for joining us this afternoon. And if you have, like Kaylee said, any questions, please feel free to enter them into the chat. Our presenters are on duty here to respond back to them. Thank you. We have no further questions in the chat, so with that, we'll like to say thank you again for joining us. And if you can think of any questions following this session, please feel free to email me with them, and we'll have our presenters respond back at a different time. But we don't want to keep you here any longer. It is give you an extra 15 minutes off to find something else to do. And again, join us for our next session on May 28th, the same time. Again, thank you very much. Have a great day. Bye-bye.